Welcome to the 8-Minute TrumpCare update. My name is John McVeigh. I'm the Faculty Director of the Executive MBA and the Healthcare MBAs at the University of St. Thomas. In this update, we are curating a range of perspectives from stakeholders on the opportunities and concerns we have about the transition between Obamacare and TrumpCare. And so today we've invited two of our executive fellows on the Healthcare MBA. We have Dan McLaughlin, former CEO of HCMC, and we have Mark Addicks, former Chief Marketing Officer of General Mills. And so Dan, I'd like to give you first response to one of 5 questions. Of all the issues being discussed this week in the area of healthcare reform, which is the one that gives you most hope?
Well, John, I'm hopeful that, in fact, the insurance that many people have through expanded Medicaid and the healthcare exchanges will continue through 2017. And I think all the people who've been talking about healthcare changes have said, yes, we're going to make sure those people stay insured.
Mark, what gives you most hope?
What gives me most hope, assuming I have some hope, is the necessity of timing. Very clearly, President Trump and the Congress have decided that they need to repeal politically, repeal the Affordable Care Act, and so time is of the essence. They need a replacement, and they know that if they don't replace quickly, there's a lot of confusion, instability that's going to result.
Thank you. Dan, from the opposite perspective, what is it that gives you most concern of the issues that are being raised at the moment?
Well, let me jump on Mark's concerns too, because I think that the delays potentially could really disrupt the markets for 2018. Congress has got to figure out what they want to do for replacement by the spring of this year so the insurance companies can develop their products for 2018. And if they don't do that, then there's a real chance that 2018 insurance markets for individuals will collapse, and that's a real concern.
Mark, what concern do you have?
My very first concern is more like a marketing concern. I worry that as we are quickly presented choices, that we're going to obscure the choices we're making under the guise of political branding. So think of death taxes as a way to talk about the options under estate taxes. I think what we could do is quickly brand these things, and the public and the decision makers really won't see the policy choices we're making.
Okay. Dan, of all the issues being discussed, what's the issue that's not being discussed that you think really should be central to our conversation?
Well, the Affordable Care Act had many sections to it, so this is beyond one, but that are important to the functioning of the American healthcare system, particularly safety nets such as funding for community health centers and rural hospitals. And I think that people have to remember when they think about repealing the act that they need to think about those very important things they need to maintain into the future.
Mark, what's the issue that's not being discussed?
In 2 words, best practices. I think any manager that was stepping into this significant challenge, the first thing they would ask is, walk me through the best practices globally, the best practices by state, as we think of enrolling people, we think of delivering the best outcomes, we think of managing costs, dealing with drug costs, et cetera. I think you can look globally and you can see some examples in Germany in terms of how they manage rates. I think you can look at simplification of plans in California. So there are a number of things we could do, and I really do worry that we're talking very little about best practices.
Okay. Thank you. Dan, what's the one issue you think that every executive, be they working in healthcare or in the corporate world dealing with healthcare, what's the one issue every executive should be thinking about in this area this week?
Well, we are in the College of Business, so I say follow the money. And a lot of the funding for the Affordable Care Act that provides for the subsidies and the Medicaid expansion came from the healthcare industry. And so I think I would want to be concerned about whether that money is still going into the industry and coming back out of the industry. So follow the money.
Mark?
I would add details. I think for the executives out there, as well as for the policyholders, really paying attention to the details. What's being covered, what's not being covered, what are the likely outcomes in catastrophic cases, et cetera. We need to be all over those, otherwise we're going to end up holding the bag.
Thank you. Dan, finally, we'd like to sum up with what's your big idea for reform and for progress in the area of healthcare? If you could control the agenda and bring a new idea in, what would it be?
I think we've learned in the individual market with the Affordable Care Act has been that we have some real ups and downs in that market, and the best way to perhaps fix that is to make it much bigger. So I think we have to start thinking about the artificial boundaries between Medicare and Medicaid, private insurance, and finding ways to make those markets larger so they're more stable.
Finally, Mark, what's your big idea for reform in healthcare?
Well, I'm going to have two.
Okay.
First one is standardization. As a consumer, I have always just been mystified as to what exactly I'm paying for, what I'm getting, how I can compare it, et cetera. And I've always thought that in healthcare there could be a better job of standardizing exactly what the products and services provided are. The bigger idea, I think, once we get a system, is how you get people to enroll, engage, and do it quickly and efficiently so that we can quickly read the data. And I cannot believe in a country that has sponsored things like Amazon or certainly all the e-commerce leadership we have, that we have not perfected an easier consumer experience. It's signing up, managing, and evaluating your insurance costs.
Thank you. Well, thank you, Dan. Thank you, Mark, for participating in our first 8-minute TrumpCare update. We hope to see you next time.